Honorable members, when the business of this House suspended, Honorable members, when the business of this House suspended, the floor was reserved for the Honorable Member for Kalani. The Chair now recognizes the Honorable Member for Kalani.
Thank you very much, Mr. Speaker. Mr. Speaker, before I start, I want to congratulate all of my colleagues, parliamentary colleagues, that is, those on this side of the House, whom I thought did an excellent job. They represented their ministries well, showed the Bahamian public as to what they've done and the way forward. And I also want to congratulate the members of Parliament on this side also, who again had represented themselves well, and they've demonstrated quite clearly why they were voted in to represent those various constituencies. Because it's quite evident, Mr. Speaker, that they've done quite a lot of work, and there's still more work that they want to complete, but they've represented their area very, very well. Mr. Speaker, before I start, there are a group of medical students today, final year medical students, who are writing their final examination today, and I want to wish them all well, because we need their services, not only here in New Providence, but the Family Islands. And I hope that all who are writing would most certainly do well and pass. And Mr. Speaker, you know I stand here today as a proud father, because one of my sons, my last son, is also writing that exam today. He didn't want me to say anything, but he and I spent this entire weekend studying together from Friday. We were both in our respective books. And he was tempted on one or two occasions to ask me a few medical questions. And I told him, oh, I can look it up in that particular book that I had on the shelf. And he said to me, Dad, please, that book was from the 1980s. But I had to remind him that the human body had not changed. The same body that was there in 1980, the same body today, though some are older, but still functional. Mr. Speaker, let me begin by offering all the fathers in the Bahamas a belated happy Father's Day, including my own father, will be 88 on the 18th of July. And Mr. Speaker, I had called my father on Saturday to wish him a Father's Day, because I had figured that I would be extremely busy on Sunday, and I know with the COVID, we are advised not to visit our elderly parent, and therefore he was called, and he gave me good advice, Mr. Speaker. He said to me that I'm speaking today But I must always remember that no man is perfect. And whatever you do, even in governance, you will make mistakes. But always remember that when you make decisions that you consider what would be best for the people and not for yourself. And once you make a decision, if you are clear within your conscience that you made the correct decision, then it will be better for you. And always remember that decision that you make, there will be some who may not necessarily like the decision. However, it will be the best decision for the nation. And always remember that you are happy with the decision you make, and that when you are out of office, you can live with that particular decision. That was the advice he gave me, Mr. Speaker, and I thought it was very good advice. And I've always followed that advice in that decisions I make with the best of my conscience, and those decisions I can live comfortably with. Mr. Speaker, one of the greatest privileges in my life was my election to serve as Member of Parliament for the constituency of Kalani. And I rise today on behalf of the residents of Kalani and on behalf of the Bahamian people, who it is a privilege to serve as head of government and to serve alongside my colleagues here in government. In the beginning of my presentation, I will offer my contribution to the 2020-2021 budget debate as Minister of Health. I will then note what is being done on behalf of the wonderful and industrious people of Kalani. The remainder and bulk of my contribution will describe some of my government's vision and program for the restoration and transformation of our Bahamas. We are embarked on this restoration and transformation in wake of the deep challenges and corresponding opportunities demanded by two of the most far-reaching events in an independent Bahamas. This, Mr. Speaker, is a budget focused on restoring our country and transforming it to ensure a better future for our people. This budget is guided by a number of core values, including a commitment to social justice and the common good, providing great opportunity for more Bahamians, social inclusion and mobility, and environmental stewardship and sustainability. I am committed, Mr. Speaker, to vigorously addressing life-giving and life-enhancing issues such as childhood, adolescent, and adult obesity, criminal justice reform, decriminalizing small amounts of marijuana, and expunging certain records for offenders, the development of a new generation of entrepreneurs and small business, expanded Bahamian enterprise and ownership of our economy, and last but not least, the ongoing and comprehensive development of our family islands. We will continue to boost access to land ownership, education and training, primary health care and economic opportunities and incentives, for young Bahamians and aspiring entrepreneurs. We know that in our world and our Bahamas, that talent is equally distributed across populations. But opportunities, Mr. Speaker, are not. If we do not feel an obligation to open up more opportunities to intersect with that of talent, we are failing in our national duty. We must act to ensure that more of our people drink from the pool of opportunity. This is the challenge that we face today as national leaders. That is the mission that we have before us. But we don't have to sit and dream of a better day. We must seize history and seize the future now. We must and we will embrace the ingenuity and the imagination of the Bahamian people to build a more prosperous, equal, just, environmentally sustainable, and healthier country. Mr. Speaker, because I'm addressing today Ministry of Health, in addition to wrapping up, I may be a little longer than usual. I try to limit myself in most occasions to at least 2 hours. I may possibly extend 3 to 4. But I will try to cut it as much as possible as I stand. Mr. Speaker, at the outset, I will address a number of matters related to the COVID-19 pandemic and the ongoing phased reopening of our economy and our society. Last week, I met with the executive team of the Medical Association of the Bahamas to discuss COVID-19 travel protocols and other matters related to the disease. I also met, Mr. Speaker, with the Nurses Association to discuss the same protocols. We are entering phase 5 of our phased reopening. Emergency powers are to be extended through the month of July 2020. Effective today, Monday the 22nd of June 2020, curfew hours are to be amended from 10 p.m. to 5 a.m. In other words, Mr. Speaker, the curfew will move from the usual 9 p.m. to 10 p.m. And that is necessary. It's only 1 hour, but it's necessary as I progress. You would see that as certain sectors of society are opened, that additional time is necessary. But as I speak, you would appreciate. Businesses, Mr. Speaker, may now operate until 8 p.m. And I wish to reiterate that PCR COVID-19 negative tests and completed health forms will be required of all visitors, Bahamians and residents entering or returning to the Bahamas. And these PCR COVID-19 tests have to be taken within a 10-day window before travel to the Bahamas. An exception to require a negative PCR COVID-19 test will be made for short travel periods of 72 hours or less for Bahamians and residents. However, Upon return to the Bahamas, these individuals may have to be quarantined for 14 days based on a determination by the Ministry of Health. Mr. Speaker, that is essential because there are certain groups of Bahamians who may have intentions of flying into the U.S. for 1 day or 36-hour trip. But the test takes 48 hours, which means they either would have to extend their period of time because they would not have obtained the test and subsequently cannot return. But if they insist that they must go, they can return, but they would be quarantined because they have entered the realms of the hotspots. So, Mr. Speaker, I would encourage Bahamians who want to spend some time abroad that they should invest and spend their monies in the family islands. There are nice opportunities, nice hotels, environmentally friendly, fresh air. Beaches are open. You can go horseback riding. You can do many things, Speaker. So I would encourage Bahamians to visit our family islands so that you would see the beauty that we have within our own shores. Indoor eating at restaurants will be allowed with physical distancing required. Sanitization and mask wearing by all staff at all times and patrons when entering and exiting the establishment. Maximum seating will be based on 50% occupancy, meaning 30 square feet per person. Mr. Speaker, we're commencing with 50% occupancy, but with time, we hope and intend on extending that to beyond the recognized 50%. However, social distancing must still be adhered to. Vendors at Arawa Key may continue outdoor dining, but are not permitted for indoor dining at this time. Roadside vendors will be standardized to ensure that proper structures, hygiene, and sanitization protocols are in place. And effective Wednesday, the 1st of July, 2020, gyms and outdoor group exercise may reopen with health safety protocols approved by the Ministry of Health. Spas may reopen with health safety protocols approved by the Ministry of Health. I also wish to announce the opening of public parks and beaches on New Providence. Not yet. Not yet. Not yet. They ain't open yet. I also wish to announce the opening of public parks and beaches on New Providence, Paradise Island, Grand Bahama, and Bimini, effective Monday, the 29th of June, 2020. Now you can...
Where say you want to hear we open it? One more week.
If I allowed you all to go today, Jesus Christ, it'll be a swarm. It'll be a mad rush. Gatherings greater than 5 people are prohibited. In other words, Mr. Speaker, though the beaches are open, there will be no beach parties. You are limited to a certain number so that we can continue our anti-COVID-19 protocol. Funeral services in a church or religious facility may be held with numbers based on the physical distancing protocols established for Saturday and Sunday services. Speaker, what that means, you have a church like the Catholic Cathedral that holds 2,500 people. There's no reason with social distancing that church cannot accommodate 700, 800, 900 individuals with proper social distancing. So the size of the church must be taken into consideration. The graveside parts of the services are, however, still limited to 30 people with physical distancing and masks. That is essential again, Mr. Speaker, because there's a tendency at graveside for individuals to accumulate or cluster together, and we're trying to minimize that. There is no need to apply to the competent authority for funeral services. Weddings may be held with numbers based on the physical distancing protocol established for Saturdays and Sunday services. And there's no need, again, to apply to the competent authority. Social gatherings in private facilities and homes may be held with up to 20 or less individuals with physical distancing, sanitization, and mask wearing. Effective Wednesday, the 1st of July, 2020, taxi services may resume based on guidelines in the Ministry of Tourism and Aviation's Bahamas Tourism Readiness and Recovery Plan. Private and public bus services may resume with 50% occupancy based on guidelines in the Ministry of Tourism's Bahamas Tourism Readiness and Recovery Plan, effective 1st of July, 2020. Mr. Speaker, it's interesting to note that most of the taxi drivers and bus drivers attended and participated in a COVID mitigation course or program sponsored by the Ministry of Tourism, and therefore all of the bus drivers and taxi drivers are already in a state of readiness.
Yep.
Establishments, taxi and bus owners are to be held responsible for letting maskless patrons enter their respective establishments and ensuring that occupancy is limited to enable physical distancing. If the requirements to wear masks and physical distance are not adhered to by patrons because the owner failed to enforce the requirements, a fine is to be applied to the establishment's owner. And that fine, Mr. Speaker, I advise it's up to $10,000 or 18 months imprisonment or both. And therefore, I again advise all restaurant owners to ensure that your patrons and your staff adhere to the protocols. A second violation will lead to a second fine at a higher quantum. And a third violation will lead to a temporary closure of the facility until health officials can be satisfied that the continued operations of the establishment would not pose a health risk to the community. Mr. Speaker, I understand the burdens of the lockdown on many of our citizens and how difficult it has been to practice physical distancing in some households. Basic matters, such as the cost of acquiring the right kind of mask and the need to clean and sanitize them regularly, has been a burden for some, depending on their circumstances. But I assure the Bahamian people and residents that the wearing of these facial masks has saved lives and protected our health. Mr. Speaker, what I'm saying is as we open our borders, Bahamians must be more disciplined and they must be more responsible. We were successful and have been successful in keeping our numbers low and keeping our death rate low. We are the envy of the world. Many will want to visit our shores. Your government has done the best it can. And as we open our shores, we depend more on you as citizens to be responsible, and you must do your part. As we continue to come out of the lockdown period, Mr. Speaker, let us not allow this new sense of freedom to overcome the discipline that we displayed up to now with regard to social distancing, regular hand washing, and mask wearing. We cannot squander the results of the hard work that we undertook as a community. We have seen what we can accomplish when we work together. Mr. Speaker, because we've worked together, we've been able to keep our COVID numbers low. As a result of us being the envy of the world, many will visit our shores. If we continue to work together, we would continue to be successful and keep our numbers low. We would build our economy, and we would build our economy quickly and even better. Mr. Speaker, each of and every one of us has a responsibility. And I say that especially to many of the young people who don't know the significance and the importance of wearing face masks in enclosed environment. As the world and the Bahamas reopen their economies, societies, and borders, there will inevitably be an increase in the number of COVID-19 cases within and across borders. Just as with the other nations of the world, the Bahamas must continue to balance health, economic, and social concerns in order to ensure the viability and sustainability of our countries. During our phased and gradual reopening, we have repeatedly emphasized the need for everyone to do their part. And Mr. Speaker, I would repeat again, every Bahamian citizen and those visiting our shores must do their part. The COVID-19 pandemic is not over, and there is no vaccine yet. The wearing of facial masks is absolutely necessary and has significantly helped to reduce the spread of the virus at home and around the world. We must all do our part and be personally responsible by wearing our mask, maintaining physical distancing, and washing and sanitizing our hands thoroughly and often. Employers and business must help by ensuring that health measures are followed by employees and customers. Those who feel unwell should stay at home. Those who are over a certain age should limit the time they spend away from home. We still have to be careful and vigilant as we reopen. We should not be complacent. We will continue to enforce health care measures, but government, I repeat, government cannot do this alone. We are still in this together, Mr. Speaker. The need for social solidarity and concern for others is as absolutely necessary as ever. I beseech and implore the Bahamian people to act in a spirit of love and unity as we continue to face the many ongoing challenges presented by COVID-19. We still have a long and difficult road ahead. Mr. Speaker, the government has had many partners and donors in the country's fight against COVID-19, many of whom I have previously acknowledged, but today I would like to mention two other groups. Immediately upon the government promoting the health and safety value of wearing a mask, a philanthropic group organized itself to meet the huge demand for masks that could be supplied by those. John and Daphne Delaney led a project to produce quality fabric masks for donation to the government for distribution to those in need in our country. The project to produce masks provided a home-based economic opportunity for sewers and others financially challenged by the pandemic. And this initiative led to the founding of Bahamas Mask and PPE Limited, referred to as Mask for All. Skilled workers quietly began making triple-layered 100% cotton and microfiber masks. To date, approximately 3,500 masks have been handmade and distributed free of charge on New Providence and various family islands. And I am advised that the production of masks continues and is providing employment and a livelihood for a number of Bahamians. Additionally, Mr. Speaker, I would like to thank Breezes Hotel and the Issa family for accommodating returning Bahamians and residents requiring COVID-19 quarantine at their hotel. This was a fine example of corporate citizenship. The government is grateful for this generosity of spirit. Mr. Speaker, it has been an honor to once again serve, albeit briefly, as Minister of Health. I am proud of the medical professionals who are leading the charge against COVID-19. I am equally proud. You ready? I am equally proud of the non-medical and administrative staff who are running the various healthcare offices on a daily basis. The Ministry of Health and its agencies work best when there is a dynamic collaboration between medical officers and non-medical officers, all playing their unique roles. Mr. Speaker, it is my privilege to announce that the Ministry of Health received a total budget allocation of $298,037,239 for the fiscal year 2020-2021. The PHA and NHI received allocation of $223 million and $38 million respectively. This year, The Department of Public Health has been assigned Head 66 to carry on its financial obligations in the next budgetary period and has been allocated a sum of $45 million. Mr. Speaker, in January 2020, a COVID-19 preparedness and response plan was drafted and disseminated to key stakeholders after much consultation. Because of the imminent threat of COVID-19, the government approved $4.5 million for the COVID-19 health response. Thereafter, a COVID-19 task force team led by Dr. Mercedal Regis was established to implement prevention, containment, and mitigation measures to minimize the exponential increase in the number of cases. Established to monitor the health system capacity to avoid an overwhelmed and overburdened health system, and provide statistical evidence to inform government's collective actions. Dr. Dal Regis, as a special consultant to the Prime Minister, is a well-renowned public health stalwart. She has daily guided a team of young health professionals as chairperson of the Emergency Operations Center, EOC, at the Ministry of Health. With the support of National Emergency Management Agency, NEMA, and PAHO, the EOC has informed and provided for the COVID-19 response. I thank all of those who have been at the forefront of this pandemic and the COVID-19 response, and for the tireless efforts expended. Gratitude is extended to the members of the EOC, the support staff of the Ministry of Health, who have been working tirelessly around the clock. Healthcare workers on front line, countless donors, PAHO, members of civil society, and the communications units at Health, the Office of the Prime Minister, the Bahamas Information Services, who ensured a robust public communications program. I also thank the members of the public who have closely adhered to the public health measures. If this commitment was not present, Mr. Speaker, the situation in the Bahamas could have been very grave and extremely difficult. Today, Mr. Speaker, the surveillance unit reports that there are 104 confirmed cases of COVID-19 in the Bahamas. Of these cases, 16 are active, 77 have recovered. And currently, there are 1 hospitalized and 11 deaths. 82 cases originate from New Providence, 8 from Grand Bahama, 13 from Bimini, and 1 from Cat Key. Mr. Speaker, I am happy to say that there have been no cases yesterday, and the last case recorded here in New Providence or the Bahamas was on the 14th of June, and there was no case since then. A large number of cases in Bimini deemed the island a hotspot for COVID-19. With the discovery of additional cases on the 12th of May 2020, the Ministry of Health advised the government to lock down the island for 2 weeks to halt the community spread of COVID-19. And effective 18th of May 2020, I advised residents of Bimini to lock down until the 30th of May 2020. Biminites have taken this preventative measure with calm understanding and appreciation. We are very proud of the cooperation and compliance of the residents of Bimini. And Mr. Speaker, I have been in constant communication with the administrator and residents in Bimini, and they are doing very well and happy that we had initiated the lockdown, which resulted in them now being free and their beaches to be open same time as that of Nassau, but no in Bimini. I'm certain they're using their beaches outside of that. Their willingness to cooperate with the lockdown resulted in the deceleration of the spread of COVID-19 on that island. And because COVID-19 remains a global and domestic threat, an additional $21,300,000 has been added to the Ministry of Health's budget in contingencies to provide funding for COVID-19 related matters.
Thank you.
Mr. Speaker, the Home Care Providers Assessment and Certification Emergency Order of the 21st of April 2020 gave effect to improved medical, therapeutic, and or other patient care in homes and in residential care facilities. This is a very practical tool to protect our elderly. In collaboration with the Early Access Training Center, over 200 home care providers have been registered and trained in infection prevention and control. The Ministry of Health will continue to work with nursing homes and long-term care facilities to ensure the ongoing protection of our elderly residents. Mr. Speaker, the work of the surveillance unit has been a major role in the COVID-19 response. The surveillance unit has conducted contact tracing for confirmed cases and contacts. They have monitored persons in quarantine and isolation at home and the government facilities. They have compiled and presented epidemiological data and assisted with home assessments and quarantine verification. Though the surveillance unit was not fully staffed as it should have been, their work has been outstanding. There is a need for an additional 7 trained nurses, and in the interim, the surveillance team currently enjoys the assistance of an experienced epidemiologist from the Pan American Health Organization, Dr. Colette Myrie. Very soon, the Bahamas must find a permanent epidemiologist to carry out this responsibility. So I send the message out. If there are any Bahamian trained epidemiologists throughout the world, your services are needed here in your hometown, the Bahamas. And we would most certainly welcome you and accommodate you. As we continue through the COVID-19 pandemic, Mr. Speaker, the surveillance unit will continue its routine work. The National Disease Surveillance Unit also monitors the health of travelers at points of entry. This is to prevent the introduction of communicable illnesses to the Bahamas. And public health care personnel are stationed at the Lyndon Pindling International Airport, and a port medical officer is on call 24/7. With the assistance of immigration and customs officers, the port health medical officer can monitor the health of those traversing our ports or our ports of entry. New Providence, Grand Bahama, and Family Island are all linked for port and other disease surveillance matters, which make the quick and calculated response to COVID-19 attainable. Mr. Speaker, the U.S. Center for Disease Control and Prevention notes, I quote, "Public health is the science of protecting and improving the health of people and their communities," end quote. Mr. Speaker, this year, the Department of Public Health has its head 66, and has been allocated funding upward to $45 million for strengthening and expansion of primary health care services. Additionally, the Department of Public Health has received assistance from external donations during Hurricane Dorian. And I take the opportunity to thank the non-governmental agencies, community stakeholders, volunteer groups, and regional and international partners such as the World Health Organization and PAHO, who came to our aid in times of disasters. I also thank the healthcare staff and community volunteers on the various islands who provided care for those displaced Abaco, the Abaco Keys, and Grand Bahama by Hurricane Dorian. Mr. Speaker, Hurricane Dorian taught us that we need to make infrastructural changes and focus on the resilient design of clinics and other healthcare facilities to withstand major storms. This monster storm brought home the need to adhere to building codes and standards set by regulatory agencies. The Marsh Harbor Primary Health Care Center, which withstood the ravages of Dorian, is a primary example of how buildings should be constructed to withstand such storms. Mr. Speaker, let me emphasize that legal residents on Abaco are eligible to apply for housing. The government will not allow the building or rebuilding of any shanty towns. Opportunities will be given for individuals, and as I go through my presentation you will see, but opportunities will be given for individuals within the Abaco community to purchase homes. The members of the Disaster Reconstruction Authority will meet with leaders of various communities to discuss the details of the housing program. We are deeply and fully aware of the need for temporary housing in Abaco and Grand Bahama. However, we must also address permanent housing solutions for the residents in the disaster zones. The Disaster Reconstruction Authority has identified temporary housing solutions for Abaco and Grand Bahama and is moving forward with the erection of domes as well as container housing units in the disaster zones. A notice of pre-qualification for the provision of a design development for mixed-use residential communities has been advertised for Abaco. The deadline for submission of interest was June 19th, and the Disaster Reconstruction Authority is currently reviewing these submissions. The sites identified for permanent housing include 2 60-acre sites in Marsh Harbor and Wilson City. Central Pines, which is a public-private partnership with the Discovery Land Company and the government of the Bahamas, will be the site for the development of 46 homes and will be gifted free of charge to 46 families. The Speaker, allow me to explain. government will provide the land. The land is the people's land. It's your land. So you are getting your land. Baker's Bay, one of its companies, Discovery Land Company, through its foundation, Discovery Land Foundation, will build the homes on these property at no charge. That is a gift to the people of Abaco. Baker's Bay, Mr. Speaker, providing the land. The government, Baker's Bay providing the home. The government providing the land. The land that I speak of already have infrastructure. And therefore, those individuals will be able to obtain those lands free of charge. The land lease for the development of the 46 homes in Central Pines is being finalized at the AG's office, and we will also develop a subdivision in Murphytown. For East Grand Bahama, members of the project management team of the Disaster Reconstruction Authority and Lands on Survey are on Grand Bahama evaluating the available properties for the development of permanent housing in Sweetings Key, McLeanstown, and High Rock. Mr. Speaker, I just want to explain that the infrastructure is already in those particular properties. However, if additional changes are necessary, and that additional changes, for example, cost $100,000, because there are 46 lots, that 100,000 is divided by 46, and therefore those individuals would have to pay about $2,500 for the home. That's only to pay back the money that the people have used to put the necessary changes.
They're going to change your name to Santa Claus. It's Christmas in June.
It's Abaco, man.
This is Christmas in June.
From the time I first served as Minister of Health some years ago, I understood that promoting greater equality in healthcare was a fundamental part of improving overall equality. Today, my government continues to place high priority on ensuring the accessibility of high-quality primary healthcare services throughout the communities of New Providence and the Family Islands. Strong primary health, what do you say, you've got island in that? Huh?
I'm involved and push down all the clinic. We should be ashamed to talk with that. We got to put people on ice.
Mr. Speaker,
Come on, man.
Mr. Speaker,
Cat Island suffered under you. Huh? I need to get up and talk with you. You couldn't even
primary health programs and services result in lower health costs. Now listen, I didn't disturb y'all when y'all spoke. Now if you want me to change course, I spoke to your leader this morning, and I told him I was going to be a gentleman. I was going to stick to the point. I was going to be factual, but I will slap him up in the last 10 minutes, as I said. You understand? So we have a deal. Strong primary health programs and services result in lower health costs, higher user satisfaction, and better health outcomes for the population as a whole. In this vein, Mr. Speaker, I am happy to report that funding allocations are proposed in the 2021 budget for the renovation and upgrade of a significant number of community clinics in the capital and throughout the archipelago of the Bahamas. The new Minister of Health Glennis, I see you. Anderson, I see you looking too. The new Minister of Health, Mr. Speaker, I will ask the Governor General to appoint, will have as a major responsibility the improvement and upgrade of health care infrastructure. The new minister will be charged with an ambitious program of upgrades throughout the country. Linked to each of these infrastructural works are important service and program strengthening initiatives for improved health care delivery efficiencies and effectiveness. Mr. Speaker, the Anstown Clinic is a critical facility serving the Camp Road and surrounding inner city. It was constructed in 1978, and after 41 years, the number and size of examination rooms are no longer adequate to accommodate its expanded scope of services and increased patient load. This clinic is long overdue for comprehensive upgrades, and these works can no longer be deferred. The Coconut Grove Clinic is another important primary health inner city facility. It was actively under renovation until Hurricane Matthew, which caused significant damage to the building and its uncompleted structural works. The Elizabeth Estate Clinic and the South Beach Clinic are the two primary healthcare facilities in Nassau currently being upgraded to strengthen their capacity for delivery of urgent care services at the community level. In addition to infrastructural works, these upgrades include the following priorities: deploying mobile point-of-care testing equipment in both of these community clinics, expanding other diagnostic capabilities, inclusive of digital x-rays, ultrasound, and ECG equipment, standardizing policies, operating procedures, and clinical protocols, and training in a wide variety of clinical and non-clinical areas, including life support and customer service. Many of these developments are well on the way and are all critical for preparing these two facilities to diagnose and manage lower severity cases requiring urgent and emergency care. This will lead, Mr. Speaker, to a reduction in the number of patients needing to go to the emergency department at Princess Margaret Hospital. It is estimated that as many as 40% of the patients visiting the emergency department can be treated at our community clinics if these clinics were appropriately upgraded and resourced, as is now being proposed under this project. The overall goal is to improve the emergency and urgent healthcare services delivered in New Providence at the hospital and community levels. Mr. Speaker, I now turn my attention to capital works planned for the Family Islands. During my last tenure as Minister of Health, a capital development action plan was developed to effect repairs to clinics on each island. I am happy to announce that during this fiscal year, capital works will be carried out to to effect repairs in Eleuthera at Spanish Wells, Harbour Island, Lower Bogue, and Governor's Harbour. Mr. Speaker, repairs will also be carried out in Andros. It is now projected that the Mangrove Key and Nicholstown Community Clinic will be completed in the new fiscal year. Mr. Speaker, I report that there are currently no physicians posted in Spanish Wells, San Salvador, Mayaguana, and Sandy Point, Abaco. However, there are physicians posted in the following family islands, one doctor deployed in each of the following islands: Berry Islands, Auckland's Cat Island, Inagua, and Bimini. 2 are in Long Island, and 3 are in Abaco. 4 are in Eleuthera and Andros, with a bi-weekly service for the residents in Mangrove Key, and 5 in Exuma. It is expected, Mr. Speaker, that later this month, a new physician will be posted in Nicholstown, Andros. In July, a doctor will be posted in both San Salvador and Sandy Point, Abaco. And in August, another physician will be placed in Abaco. In September, a doctor will be posted in Spanish Wells. And before the end of the year, there will be a doctor placed in Moores Island, Abaco. Mr. Speaker, I wish to report that $1,101,864 in the 2021 budget will be used to pay the salaries, allowances, and stipends for contractual public health authority workers. The Ministry of Health is cognizant of the need to build skill capacity in the health system. There is a shortage of trained and experienced health services administrators in New Providence and the Family Islands. And accordingly, a team has been identified to review this matter and make recommendations with strategies for training, recruitment, a career path, compensation, and retention of these vital staff members. Consideration will also be given to the development of public-private partnerships for outsourcing preventative maintenance and upkeep of healthcare facilities in New Providence and the Family Islands. Mr. Speaker, I would like to thank all the volunteers and external partners who provided their time and services to assist with the cleanup and restoration of healthcare services in Abaco following Hurricane Dorian. A special thanks is also extended to the Samaritan First Ministers who assisted greatly with the repairs to the Hope Town Clinic. The Ministry of Health wishes to thank our closest partner, PAHO, for purchasing generators that were utilized in Cooperstown, in Turtle Key, Hope Town, Manawar Key, Foxtown, and Moores Island Clinic. Mr. Speaker, nurses comprise the largest group of healthcare workers. As noted by former President Barack Obama, I quote, "Often with little power or sway on their own, nurses, mostly women, historically, have been a force of will and a sense of common decency and paved the way forward, the way towards better care and a more compassionate society," end quote. In this spirit, Mr. Speaker, the recruitment, training, and retention of nurses remain a major priority for the Ministry of Health Consequently, funding will be expended in the support of the nursing cadet program for high school students, the nursing finalists who transition to registered or enrolled nurses, and the nursing grant and trained clinical nurse programs at the University of Bahamas. Mr. Speaker, I am delighted to report that $785,000 has been allocated in this fiscal budget to pay nursing tuition and grants to the University of Bahamas. And $1,250,000 will also be utilized to pay stipends for trained clinical nurses and nursing interns. The Ministry of Health, Mr. Speaker, will invest in the postgraduate training and exposure of nurses to new and advanced skills. Despite being interrupted by the COVID-19 pandemic, the ministry is determined to ensure the training of 22 registered nurses in the midwifery program at the University of Bahamas. Determined to ensure 7 nurses already enrolled in the emergency nursing course. Over the last few decades, the profession of nursing has grown by leaps and bounds, allowing nurses to play a crucial role in the health promotion, disease prevention, and treatment. There will be approximately 110 nurses graduating this year from the University of Bahamas. And the Ministry of Health has improved many of our compensation packages for nurses. We encourage nurses, Mr. Speaker, to consider signing up with the public service instead of seeking employment overseas. The training and wealth of experience one gained in the public sector are invaluable and irreplaceable. I ask the nurses to talk to mature nurses, talk to some of the elderly nurses who have been in the system for some time, and hear what they have to say. I also ask that they review the information that was published in the nursing magazine during Nurses Month in May of 2020 and determine the path of which they want to follow. I encourage graduating nurses, Mr. Speaker, to sign up to work with the public sector. Mr. Speaker, the great challenge we face in nursing is retention. We need to continually encourage our nurses and compensate them when it is due. Mr. Speaker, I attended medical school in Jamaica before I went off to London. And it was disheartening to see how the nurses worked almost 24/7. And the salary scales at that time were minuscule. But in spite of that, they performed and did their work with honor and with pride. But what was most demoralizing and painful to me was to watch as nurses retired. They had no savings even to purchase a home. And many of the nurses, upon retiring in Jamaica, had to live with their kids or other family relatives. The speaker, that bothered me a lot to see medical professionals who worked so hard and had to end up at the end of their career living with their children because the salary scale did not allow them to accumulate any form of savings or accommodation. And Mr. Speaker, it is essential for us to find a formula, that our nurses do not fall in the same situation. And Mr. Speaker, God's willing, we will find that formula so that our nurses will be properly accommodated. Nurses perform unique duties and make up the majority of workers on the front line. We would like to thank all nurses for the work they do and continue to render. Mr. Speaker, the Public Hospital Authority is responsible for the management of the nation's 3 public hospitals, Princess Margaret Hospital, the Rand Memorial Hospital, and the Sandlands Rehabilitation Center. The PHA, or Public Hospital Authority, is also responsible for the Grand Bahama Health Services, which comprise the Rand Memorial Hospital and a network of 10 public clinics. Agencies also associated with the PHA are the National Emergency Medical Services, NEMS, and the Supplies Management Agency. With a workforce of 4,000 employees, the PHA is focused on efforts to maximize opportunities for financing healthcare costs, invest in human resources for health, and redevelop acute care units of the hospitals. Mr. Speaker, for the 2020-2021 fiscal year, the PHA was allocated $223,455,825 to carry out its critical essential services. This amount is $12,233,817 less than what was allocated last year for the 2019-2020 budget. In an environment where the use of healthcare is on the rise, PHA must rise to the challenge to collect fees for services rendered, especially from those who have the ability to pay. Mr. Speaker, the healthcare system presents challenges. Currently, there is a need to accommodate more than 21,000 admissions annually. This means that there are some 271,410 annual patient days. And with social distancing requirements and the need to strengthen infection prevention and control practices, there will be a reduction in the overall bed complement. Currently, there are 341 adult and pediatric beds and 56 neonatal beds. With a number of wards closed for renovations, the hospital is 50 beds short. After renovations of the wards are completed, the bed capacity will increase, but within the parameters of social distancing. The authority must maximize opportunities for financing healthcare costs by focusing on the following revenue-enhancing initiatives. 1, improve the infrastructural environment in which care is delivered. They must pursue measures to correct systemic challenges to registering, billing for, and collecting on services rendered. This is exacerbated by the change in services required by the public in transitioning from communicable diseases to long-term chronic care services for largely preventable conditions. We must engage the National Health Insurance Authority for the provision of healthcare services via formal provider agreements that will allow PHA's collaboratory at Princess Margaret Hospital and its primary care clinics to be registered as NHI providers. This not only guarantees equitable access to care and NHI benefits for NHI patients, but it also potentially generates revenue for the authority in the form of capitation payments for PHA's patient panels. They must review and revise policies and practices that impede revenue collection. They must repeal and replace gazetted fees to reflect the true cost of care. They must implement bundled billing for services, targeted third-party payers, negotiate preferred provider status with insurance companies, utilize collection agencies to pursue collectible receivables, and they must implement information systems, integrated health information system, IHIMS, to support appropriate billing and collection for services as well as plan health care service delivery. Mr. Speaker, a major objective of the authority over the next 5 years is to transition to a cost recovery model to reduce its dependency on the public treasury. And to achieve this goal, PHA will take the following concrete steps. Implement cost reduction measures, including outsourcing of appropriate services, consolidate and renegotiate contracts, improve inventory management, continue the transition to solar energy, conduct a telecommunications audit, consolidate group purchasing, and maximize economies of scale for supplies and pharmaceutical management. Mr. Speaker, PHA management is completing a set of priority capital projects for the urgent renovation of several patient care areas. In this budgetary period, the government has allocated $30 million toward the phased redevelopment of the Rand Memorial Hospital, major improvements to the physical environment of PMH and areas of Sandlands Rehabilitation Center. Of this total, Mr. Speaker, $21 million is earmarked to the phased development of the Rand Memorial Hospital, and $9 million is allocated for the phased redevelopment of PMH and Sandlands. The funds will address the urgent phased improvements to patient care areas at PMH, and areas currently under renovation and to be repaired are as follows. The old intensive care unit, the old operating theater, male surgical ward east, public bathrooms and legacy entrance and specialty corridor, the eye ward, the children's ward, female medical ward. Number 2, the old physiotherapy unit, which will allow for the expansion of the dialysis unit. Accident emergency department, which is an ancillary redevelopment project being fast-tracked for the improvement of all emergency and urgent health care in New Providence. Mr. Speaker, I am pleased to advise members that construction initiated as part of the urgent and emergency care project in collaboration with the Department of Public Health and the Ministry of Health continues as planned. A year ago, members were informed that the first phase of this project is expected to reform access to urgent care and emergency care services in New Providence, including the upgrade and expansion of PMH's accident and emergency department. Construction works began in November 2019, with significant progress having been made to date in the orthopedic and wound care areas. I wish to remind the public that Elizabeth Avenue south of Shirley Street remains temporarily closed to facilitate enabling works at the Princess Margaret Hospital's emergency room. Plans are now underway to transition to the second phase of this marquee project. Upon completion, this $10.4 million investment will remain upgraded treatment rooms, enhanced security, proper emergency vehicle access, and appreciable improvement in the aesthetics of this historically high traffic service area. Mr. Speaker, because of Hurricane Dorian in September 2019, the Grand Bahamas health system was devastated. A memorandum of understanding with Samaritan's Purse for the provision of a 40-bed field hospital ended on the 7th of March 2020. An engagement with Carnival Corporation and other international aid agencies to salvage the existing hospital is also ending. I wish to inform colleagues that contracts are being awarded to several local companies and work is progressing on the Ryan Memorial Hospital. It is anticipated that patients and staff will be able to reoccupy the hospital within the first quarter of the 2020-21 fiscal year. This does not distract from the urgent need for a new replacement and climate resilient hospital for Grand Bahama and the Northern Bahamas. These restoration efforts, Mr. Speaker, are only temporary. The extent of the damage is beyond allowing long-term reoccupation of the existing facility. And based on preliminary assessments, it is anticipated that capital costs to restore core clinical and supporting administrative services will be approximately $4.6 million. And this does not include the cost to replace IT-related and other equipment lost as a result of the hurricane. Early in the 2020-21 fiscal year, National Emergency Medical Service, NEMS, will benefit from the acquisition of 7 new vehicles, that is ambulances. 2 for the island of Grand Bahama, 1 for Abaco, and 4 for New Providence. An estimated cost of $815,000. This investment will augment the existing fleet and strengthen pre-hospital care. Mr. Speaker, in 2019-20 budget, NHI was allocated $20 million. At the time, NHI had approximately 55,000 enrolled beneficiaries. Currently, NHI has more than 77,000 enrolled beneficiaries and has been allocated $38 million for the 2020-21 budget year. Despite the COVID-19 pandemic, the number of beneficiaries continue to increase each month. And the budget allocation for NHI in 2021 is $38 million, a significant increase from the $20 million allocated in the 2019-2020 budget. In these difficult times, a 47.3% increase in funding from 20 to 38 million is recognition of the success of NHI. This speaks to the evidence of reduced loads on our public clinics. This is something that NHI wishes to maximize more effectively. The success experienced to attract new beneficiaries is proof of NHI's popularity with Bahamians. In a survey conducted in 2019, approximately 95% of beneficiaries were satisfied or very satisfied with the services they received. Mr. Speaker, given the budgetary challenges we are currently faced with, as well as in an effort to improve access to affordable health care, we will be introducing some changes to the primary health care system in the Bahamas. And these changes will impact the operations of the biggest state-owned enterprise, the Public Hospital Authority. In fact, in the 2020-21 budget, subventions for the PHA represent some 55% of total subventions and nearly 9% of the current expenditure. Aside from reducing the burden currently placed on the public purse by this entity, major reform of the primary health care system in the Bahamas will be the central tenet of our health care spending as we seek to provide accessible, affordable, accountable, and value-driven health care for every Bahamian. We are on a journey to universal health care, and improvements to our primary health care system is a first step. The Speaker, currently, primary care in the Bahamas is delivered in a fragmented manner, with the government funding 3 separate delivery mechanisms. The National Health Insurance Authority, with its network of over 90 healthcare providers, the Public Hospital Authority, with the Agape Clinic and services in Grand Bahama, and the Department of Public Health, with the government's public clinics. Together, these delivery mechanisms represent a duplication of services, inefficiencies in resource allocation, disconnected care delivery, and a lack of consistent service standards. And taken together, these result in excessive healthcare costs, among the highest in the region, and an overall lower quality of care being delivered to the Bahamian people. NHI, Mr. Speaker, is truly a Bahamian success story. The program currently provides primary care physician and lab services to almost 80,000 Bahamians through a network of over 90 physicians and 8 laboratories across 5 islands. NHI is growing at a rate of approximately 2,200 beneficiaries per month, and the program is very well received by beneficiaries, with an approval rating of over 95% and strong support from the general public. The program delivers services at an average cost of only $217 per beneficiary per year. This is a cost much lower than the cost of services provided by other parts of the public healthcare system and private insurance companies. Mr. Speaker, NHI is transforming primary care delivery through 3 main avenues. First, by introducing modern payment mechanisms that fix the cost of care. Second, by the enforcement of quality and service standards for doctors and laboratories. And lastly, through the recent introduction of a cutting-edge electronic health record. The information made available through the electronic health record will lead to the improved health outcomes and reduced costs of care. The introduction of a national electronic health record will revolutionize the primary health care system. The benefits include enhanced security and patient privacy of sensitive health information, access to a patient's personal health portal, real-time and paperless documentation throughout the patient's continuum of care, and telehealth. Through the implementation of telehealth, providers will be able to access patients in remote locations and those with mobility challenges. Telehealth, Mr. Speaker, will notably improve the access of Family Island residents to their providers through a virtual platform, reducing the need and expenses of traveling for services that can be delivered through the electronic health record. Mr. Speaker, primary care delivery today is estimated to cost the government $83.3 million each year. And this has the potential to increase by some $44.4 million by 2025 to nearly $128 million if we do not significantly change the delivery model. Thus, the government is proposing the National Health Insurance Authority lead a series of reforms which may effectively and efficiently address these ongoing challenges. We are referring to these reforms as NHI 1.1, and this initiative is estimated to save the government of Bahamas approximately $62 million over the next 5 years. It will require no additional taxation or employer mandate, which would have included a mandated insurance premium and will mean minimum disruption to the private health insurance industry. Indeed, it will ensure that every Bahamian and resident has consistent access to a family doctor without a co-pay or deductible. Mr. Speaker, to reiterate, NHI 1.1 will be implemented without any additional taxation or payment by employers or employees. NHI 1.1 will be funded by the savings created by consolidating and reorganizing programs to eliminate identified inefficiencies in the primary healthcare system. The NHI 1.1 framework integrates primary care program delivery under the existing NHI model by establishing a single standard primary care health benefit for all Bahamians and residents. And this benefit will include existing NHI coverage for visits to a family doctor, laboratory tests, as well as new diagnostic imaging services, cancer screening programs, and an emphasis on patient-centered care. The NHI Authority will engage all providers of these benefits on a contractual basis, and all services will be made available without co-payments or deductible. The changes will integrate the Public Hospital Authority and the Department of Public Health primary care clinics under the NHI model. It will extend the benefits of an electronic health record to all Bahamians and residents and implement the NHI quality program for all primary health care facilities in both the public and private sector. Mr. Speaker, the estimated cost to deliver NHI 1.1 in 2025, which will provide additional benefits beyond what is currently provided, is $110 million. This represents saves of some $17 million over the next 5 years. We can realize these savings by reducing the number of primary care clinics directly operated by the Department of Public Health and Public Hospital Authority, and engaging private sector capacity through public-private partnership. The NHI 1.1 will also reduce capital expenditures at public health facilities and decrease the burden at secondary and tertiary care facilities as a result of improved primary care access. With its innovative contractual reimbursements with private providers, NHI 1.1 will emerge as a model public-private partnership where public funding seeks to harness and leverage the efficiency, creativity, responsiveness, and accountability of a privately delivered healthcare service. Over the near term, NHI will commence detailed planning discussions and mobilize a project transformation office in coordination with the Ministry of Health, Ministry of Finance, and Public Hospital Authority. And shortly thereafter, NHI will once again undertake formal stakeholder consultations, which will allow Bahamians to have meaningful input to the proposal. Mr. Speaker, that's it for health. That would have been a bit too much for a new minister to present. I want to update the residents of Kalani on a number of developments in the constituency. I understand every time I say new minister, you looking this way. I got some good news for you, though. I got good news for you.
Let us just perk up.
This is something you had requested, you had asked, and you fought for your people. I'm going to deliver it for you today. For the past 3 months, Mr. Speaker, I am pleased that my constituency association has been able to distribute food items, food vouchers, and masks to residents who needed these items. We have partnered with several food network distributors to assist constituents with food packages bi-weekly. To assist in this effort, a team secured personal contact with Gambia and Mount Pleasant residents through visits and phone calls. This information has been put in a data bank so that food can be home delivered. Members of our constituency association also showed their appreciation to officers at various police stations in the area by taking them refreshment and fruits to show appreciation for their hard work and dedication to protecting and serving us. And Mr. Speaker, those who drive by Mother Lewis Park opposite Nesbitt will see that work is continuing on the refurbishment of the park, which will be a model park restoration and will soon be completed. I am pleased that a number of residents of Kalani have, through our job enhancement and placement efforts, have secured jobs in the private sector. And I note that a number of credit unions have hired an excellent group of young people from the Kalani constituencies. A number of college students have pending job placements once hiring resumes in a number of sectors. There are various pending works in Kalani, including the seawall in front of CBJ. The seawall.
Will be done.
Oh, this is a good minister of work. I almost mixed up. You see, let me let the public know, because I keep looking this way so they know. Desmond Bannister is not going to Minister of Health. All right? I didn't say that. I didn't say that. Is Shortland? Oh, okay. But I'm young, so I can go there. Anyhow, I don't know. There are various pending works in Kalani, including the seawall in front of Sea Beach area and pending road works, which I will update residents on these works as we proceed. Mr. Speaker, I have learned long ago that life is not the challenges, it is not the struggles, and it is not the setbacks alone, which ultimately determine the character and the success of an individual or a people or a nation. How we overcome our challenges and how we strive for a better future also helps to determine character and success. But even as we forge new possibilities, new ways of doing things, and a new country, we must acknowledge and understand the past and how we got where we are. The people of the Caribbean overcame slavery and colonialism to forge new nations and to advance self-determination as free people. We cannot understand the challenges of the present unless there is a fuller understanding and acknowledgement of history. It is dishonest, disingenuous, unfair, and unjust to tell a people who are being oppressed or disadvantaged by slavery, colonialism, and racial inequality to simply get on with things without accepting and acknowledging the past. Dr. Martin Luther King Jr. used to say, it's all right to tell a man to lift himself up by his bootstraps, but it is cruel jest to say to a bootless man that he ought to lift himself up by his own bootstraps. It would be likewise ingenious and dishonest not to understand and to continue to acknowledge the events of the past 10 months, which have devastated our economy and resulted in many thousands of Bahamians losing their jobs, their businesses, and their livelihood. Never before in the history of an independent Bahamas have we experienced an unemployment rate of approximately 30 to 40%. Global tourism and travel were decimated, and most of it came to a grinding halt. Government revenues have been shredded at home and around the world. The World Bank has said the pandemic is expected to plunge most countries into recession this year, with per capita income contracting in the largest fraction of countries globally since 1870. The U.S. Federal Reserve, their central bank, is projecting a contraction of 6.5% in the American economy this year, which will affect our Bahamas. The Canadian economy contracted by 8.2% in the first quarter of this year. And the British economy shrank in April by a record 20.4%, a stunning number for such a dynamic economy. Our Caribbean and CARICOM neighbors are likewise economically devastated. Because of the events of less than a year, it is the primary moral responsibility of my government to aid the tens of thousands of Bahamians in need of jobs, social assistance, food, and tangible hope. It is our historic obligation to restore and to transform our Bahamas. The historic events of Hurricane Dorian and the COVID-19 pandemic have occurred on our watch. We must not forget, Mr. Speaker, that when we came into office, we were also struck by Hurricane Irma. It was the first time in the history of the Bahamas that we had air evacuated Bahamians from the southern islands to the central islands, and we had lost not one life. It is our obligation and responsibility to respond boldly, creatively, and with compassion, especially to aid the poor and the vulnerable. The twin crisis of natural disaster and pandemic pose grave and unprecedented challenges, but also extraordinary possibilities to build a new Bahamas. History has demanded of my party and my leadership that we restore and transform the Bahamas. Mr. Speaker, in his budget presentation of the 2020-21 budget communication, the Deputy Prime Minister and Minister of Finance, a member for East Grand Bahama, laid out the government's initial projections for the impact of COVID-19 on the public finances. We are facing a fiscal deficit of $1.3 billion. This is a first for the Bahamas. But the Bahamas had not previously experienced COVID-19 nor Dorian. As a small open economy, we have always been vulnerable to external shocks, and this vulnerability deepened over the past decade, commencing with the 2008-2009 global financial crisis, followed by a series of more and more powerful hurricanes. And even still, the predicament we find ourselves in today is far different from any we have faced before. And today, Mr. Speaker, we face two crises, both of historic economic intensity, and they have hit the Bahamas at one time in one fiscal year. But fortunately, my government has taken the challenge in responding to the people of the Commonwealth of the Bahamas in an unprecedented manner. Fortunately, we had some headroom because of decisions we took early in this administration to clean up public finances and to restore the country from the hangover and economic mess left by our predecessors in office. Mr. Speaker, from the outset of the COVID-19 pandemic, we quickly implemented a mix of dynamic policies with the help of various stakeholders to provide assistance for those impacted by the virus. These policies ranged from food and rental assistance to temporary income replacement. We offered tax credit programs and loan and grant programs to support businesses' continuity and, most importantly, to help people keep their job. We assisted Bahamians in practical ways. Mr. Speaker, to chart our way through the remainder of this pandemic, my government has laid out our Resilient Bahamas restoration plan for the next 12 months. Our short-term plan will continue to take us through the difficult period. It is rooted in 5 main principles. First, we will ensure the health and safety of each and every Bahamian citizen. And in doing so, we will continue to equip our healthcare system with the necessary funding to ensure it is adequately prepared to battle this and future pandemics. We are increasing our investment in the improved healthcare infrastructure. Even after we have treated our last COVID-19 patient, our system will be able to respond to any future crisis that may put pressure on the public healthcare system. Mr. Speaker, my government will make certain that all vulnerable Bahamians and residents have access to food under the watch of my administration, we will see to it that no one goes hungry. Through an expanded support of the Department of Social Services feeding programs and the work of the National Food Distribution Task Force, we will ensure that all Bahamians have adequate food supply. A $25 million allocation for food support to the Department of Social Services is a testament to this. The National Food Distribution Task Force was created by government to respond to the increased food security needs as a result of the COVID-19 pandemic. It is a groundbreaking community-based partnership between government and non-governmental organizations. The task force is built on existing models of success, leveraging existing expertise and widespread networks throughout the country. The government, Mr. Speaker, is funding 85% of the cost for food distribution, and NGOs are funding 15% through donation to these groups. The food distribution plan is delivering emergency food relief for 12 weeks from June 1st to August 31st, 2020. And during April and May, through governmental organizations and private sector, 137,350 people have been supplied with food at a cost of $2.02 million. 41,014 units, which include parcels or vouchers, have been distributed. I am advised, Mr. Speaker, that since the formation of the Food Distribution Task Force, the government has injected $900,000, which has been used to assist more than 76,000 people. 5,054 units, inclusive of food parcels or vouchers, have been distributed. The government released an additional $500,000 to the task force this past Friday. The first COVID-19 emergency food coupon was issued on the 7th of April by the Ministry of Social Services. Since then, a total of 1,098 individuals have received coupons at a total value of $134,050. Outside of that amount, a total of 120 clients of the Disability Affairs Unit received COVID-19 emergency food coupons at a total value of $6,720. And these coupons, Mr. Speaker, were issued from the 20th of March to the 5th of June. This is one of the largest and most unprecedented such food programs in the history of Bahamas. It is a massive logistical program comprising the entire country. It is also one of the largest ever public-private social care initiatives in the history of Bahamas, utilizing a caring network of faith-based institutions and NGOs. New Providence has been divided into 4 major distribution zones. Grand Bahama is divided into 5 distribution zones. The zone leaders for the distribution programs are as follows: New Providence Nassau City Zone, Lend a Hand, Bahamas. Northeast Zone, Bahamas Feeding Network. Southeast Zone, Bahamas Red Cross. West Zone, Hands for Hunger. Abaco, IDEA Relief. Grand Bahama Task Force. Elutra, One Elutra. Northern Bahamas, just getting ready. Northern Bahamas, Bahamas Red Cross. Southern Bahamas, Bahamas Feeding Network. Nationally, the Department of Social Services. And I must say, Mr. Speaker, the Minister with responsibility for social services has been doing an excellent job to ensure that zone leaders are partnering with other groups in their zones to maximize outreach effectiveness. Mr. Speaker, in our islands, thousands of Bahamians have been either temporarily laid off, furloughed, or terminated as a result of the necessary lockdowns and physical distancing to stop the spread of COVID-19. This means that thousands are now without income, even though they still have families to feed and people to take care of. Hence, my government has made it a fundamental priority to put cash in the hands of displaced Bahamians through special unemployment assistance program. This initiative comports with our third pillar, which is about extending and expanding existing policies geared toward sustaining employment. We are providing direct assistance to self-employed individuals who have been unable to support themselves by providing temporary income replacement over the next several months. As we reopen our economy in phases, this income replacement will provide bridge support to those individuals to begin to get back on their feet. Indeed, a special allocation has been placed in the Ministry of Finance to be able to extend the employment assistance to individuals whose assistance will come to an end of their 13 weeks of unemployment assistance. The benefit will be extended from 13 weeks to 26 weeks. My government, Mr. Speaker, has budgeted over $40 million to provide a special allowance for those still unemployed when their NIB unemployment assistance ends. We will administer this special program through the NIB, as we are presently doing for self-employed individuals. But it is important to point out that this will not be NIB funds, nor NIB assistance. Instead, it is our recognition that tens of thousands of people will still need some measure of cash assistance after their NIB benefits expire. As such, the government is committed to directly assisting these individuals for an additional 3+ months. Accordingly, this benefit is being extended from 13 weeks to 26 weeks for those who became unemployed due to COVID-19. Mr. Speaker, I want to stress that the monies provided is not NIB's money. That money, the Minister of Finance is making such monies available to help and assist our Bahamian populace. There are many employers who should be commended for going above and beyond to continue salary payments or other forms of support to employees, even as businesses were shuttered and employees had no work. The House might recall, my passionate call for employers to share the sacrifice, and many businesses responded. Mr. Speaker, we know it is not easy to maintain payroll to sustain commercial rent payments or mortgages and other operating expenses with no income. And that is why my government is providing ongoing payroll support through its tax credit and deferral programs. As the economy reopens, this program will allow businesses to hold on to the cash they have earmarked to settle tax obligations. Businesses can redirect the money from the tax credits and deferrals to pay non-executive staff payroll. This, coupled with the COVID-19 business continuity support offered through the Small Business Development Center, will continue to help businesses to remain viable and to retain their employees. This was designed to help guard against more domestic job losses. To date, Mr. Speaker, the SBDC has processed close to $36 million in business continuity loans and grants to 508 small businesses as part of the government's special COVID-19 response. This is allowing those Bahamian small businesses and entrepreneurs to keep their doors open and to maintain some 3,900 employees on their payrolls. Many of these small businesses would have closed and laid off or terminated staff without this direct support from the government. This is the support. Mr. Speaker, this is support to the proverbial small man, those businesses who could not get funding from the commercial banks. More cash for feeding programs, more cash for unemployment assistance, more cash for small businesses. This is a major social justice. Mr. Speaker, let me put it another way. This is truly a matter of social justice. And we are doing so at historic levels in our country to meet a historic challenge. I got this for one. We are not about talk on our side, Mr. Speaker. We leave the self-serving and idle rhetoric to the opposition. We are about action. We are in the business of getting the people's business done. For Bahamian entrepreneurs and small businesses, we have budgeted an unprecedented $55 million in support. We recognize that for many of them, they will continue to need grants and loans to help them weather one of the worst economic periods ever in the history of the Bahamas. We also want to make sure that we are providing sufficient allocation for the new businesses and strategies that will emerge in the aftermath of the COVID-19 pandemic. Mr. Speaker, the fourth pillar of our plan for a resilient Bahamas is to develop and implement a robust and dynamic mix of policies that will accelerate a rebound in our domestic economy. A strong recovery, Mr. Speaker, calls for innovative and vibrant ideas to ignite the growth potential of the economy. To achieve this, we have increased the allocations for capital expenditure using government funding to stimulate the economy through construction and investment in infrastructure. I am informed that the groundbreaking for the new airport in Exuma is scheduled for October of this year. Mr. Speaker, I think it's essential for the member for Exuma to see what we are doing for him. Mr. Speaker, the member is bold. The member is bold. This is only the start of what we're giving or doing for Exuma. But I don't know if you will be around.
We may give Exuma a new member.
This is Exuma again.
For the cameras together.
Mr. Speaker, work continues to progress for the new airports for Eleuthera and Long Island. I want to say that the same design for Exuma will also be the design for Eleuthera. North Eleuthera. But Mr. Speaker, I cannot stand here and not demonstrate the new airport for Long Island. We didn't say anything about Cat Island.
No, we take care of y'all too.
This again, Mr. Speaker, Long Island. Mr. Speaker, we are investing. Exuma, we have a lot more for Exuma. If you be nice, we'd invite you to attend. In that case, it won't be finished until 2040 then. You know, y'all don't finish anything, you know. Y'all have a history of starting and not finishing.
For 18 years, PM. 18 years they represented Exuma.
Yeah, they had Exuma a long time.
18 straight years, and we are
We're gonna fix their roads too. What else you need, Exuma? Anyhow, Exuma shows no care for Exuma, so let me carry on. Mr. Speaker, we are investing in our people by expanding the resources set aside for free education at the University of Bahamas and Bahamas Vocational and Technical Institution by some $2 million. As I have before, I remind this House that the previous PLP administration once proposed to double the national investment in education and training. Not only did they fail to keep this promise, they actually cut the education budget. We have a different vision for education. Mr. Speaker, for those in Abaco and Grand Bahama, some of whom are still recovering from the devastation left in the wake of Hurricane Dorian, we have extended the exigency orders and the Special Economic Recovery Zone designation. All exemptions currently in place will be extended to December 31st. Thereafter, concessions will be continued to be granted on building materials for the period January 1st, 2021 to June 30th, 2021. And my government has made the decision to accelerate initiatives to boost food security and energy reform for the future development of our economy. Finally, Mr. Speaker, the fifth pillar of our plan is accelerating our government reform agenda. And this agenda includes the digital transformation of government services. Mr. Speaker, do you know, in terms of digitizing the services in the Bahamas, Cabinet has now been digitized. We now have e-cabinet. Yes. So, babe, you don't, can't carry those big packages anymore.
Can't you see that phone?
So, Mr. Speaker, for the first time, we now have e-cabinet. It also includes the rationalization of state-owned enterprises who benefit from approximately $400 million in government funding every year. These state-owned enterprises need to become more self-reliant instead of relying on taxpayer subsidies. They need to become more efficient in their management and innovating in their service delivery. This, along with a set of targeted revenue enhancement measures, will help to close the deficit gap in the medium to long term. In keeping with our efforts, Mr. Speaker, to reform public financial management, the Minister of Finance tabled a landmark public procurement bill to restructure the way we award government contracts and to ensure greater transparency in procurement processes. Mr. Speaker, our plan is robust. Our plan is people-focused. Our plan, Mr. Speaker, is visionary. We are faced with what no government in the Bahamas has ever faced with, and we are responding in an unparalleled manner. And we are not alone. During this unprecedented economic crisis, governments are increasing public spending to support the economies as they must in order to avoid an even worse economic catastrophe. We have studied both historical antecedents and we are examining the current examples of how countries, large and small, have dealt with economic shocks. We are guided accordingly. For example, during the Great Depression, United States President Franklin D. Roosevelt increased the government's role in the economy by instituting a series of projects and programs that helped to employ close to 8.5 million people. Packaged as the New Deal in Phase 1 and the second New Deal in Phase 2. These programs ultimately changed the economic landscape of the United States. According to the St. Louis Federal Reserve, collectively these projects and programs cost the U.S. government some $653 million. Mr. Speaker, even as we look at government's responses to the most recent crisis, the COVID-19 pandemic, we see broad-based stimulus packages passing in other jurisdictions. The Chinese government announced discretionary fiscal measures for some 3.5% of GDP, equivalent to hundreds of billions of dollars. These measures included increased expenditure on epidemic prevention and control, accelerated disbursements of unemployment insurance, and extension to migrant workers, tax relief, and the waiver of Social Security contributions. In the United Kingdom, the government provided business support through loans as well as social support by supplementing 80% of the earnings of self-employed individuals and furloughed employees. The United Kingdom government also provided funding allocations to public services and charities and a host of tax relief measures, including tax holidays and direct grants for small firms. In the region, Mr. Speaker, we have seen governments of other small open economies inject fiscal stimulus packages in response to COVID-19. St. Lucia Social Stabilization Plan represents some 2% of GDP and included temporary income support, tax payment extensions, tax credits to companies, rental payment suspensions for companies renting from the government, and other measures. St. Kitts and Nevis implemented a fiscal stimulus package of some 3.75% of GDP, which heavily support the small business community and the most vulnerable among our society. In Trinidad and Tobago, the government has provided income replacement, tax relief, food assistance, and a number of other social protection measures. Mr. Speaker, as history and present examples demonstrate, responsive governments the world over increase spending in the wake of a crisis to support their citizens and to help place their economies back on a stable footing. It is my government's obligation to ensure the viability of our economy by setting policies and programs that are conducive for productivity and strong private sector growth. This, Mr. Speaker, is a responsible governance. This is the kind of governance Bahamians expect. This is the type of governance that my government will provide in order to help restore and transform our economy and our country. And yes, Mr. Speaker, this comes at a cost. To be exact, a cost of $1.3 billion for the upcoming fiscal year. But Mr. Speaker, this is $1.3 billion invested in our citizens to support the business community to support thousands of households in need. It is $1.3 billion investment in our plan for a resilient Bahamas, regardless of how the members opposite try to politicize our efforts. It is $1.3 billion we will spend for the sustenance of all Bahamians. First, the opposition lamented that we were too worried about the numbers and demanded that we increase spending, and now that we have increased spending, they're calling it reckless. They cannot make up their mind about their criticism because their opposition to our plan is insincere. While they fake their indignation to create a political spectacle, we will carry on and govern this nation with steady, focused, and clear leadership and direction. We borrow for and on behalf of the Bahamian people in their time in need. Look at us, Mr. Speaker. We all have a heart. We will not just sit here in office and watch our people suffer and do nothing. Every dollar we borrow is to help ease the burden on a Bahamian family. We are not distracted by those who like to criticize just because they want power or because they have a personal grievance, and those who oppose simply for the sake of opposing. The Bahamian people put us here because they had faith in us to look out for them as opposed to the side opposite. And I assure the Bahamian people that we will account for all the monies that are borrowed and that the country will see and feel where the money is going. Mr. Speaker, I mentioned earlier that our policy making in the aftermath of COVID-19 has to be innovative. It must be progressive. To this end, I appointed the Economic Recovery Committee, ERC, in late April, which has been charged with presenting a bold vision for a modern Bahamian economy that is stronger, more diversified, future-driven, and fully integrated. Let me dispel a misguided view that are circulated. The Bahamas' draft National Development Plan sets various developmental goals for our country. Hard work was put into creating this plan. The foundation of that plan is based on the United Nations Sustainable Development Goals, which the Bahamas continues to pursue in various forms. Concrete work is stemming from elements of the plan by ministers of the government and key priorities under the work of the Prime Minister's Delivery Unit, which I will speak to below. The work of this new Economic Recovery Committee is not a repeat of those efforts. The National Development Plan is a long-term policy document created pre-COVID times. The work in the Economic Recovery Committee is to come up with emergency policy recommendations now in a post-COVID environment. We are in a new world and a new reality requiring new ideas for this moment. Indeed, the ERC, a public-private committee, recently published its scope, which is to shape policy recommendations to create an economy that is resilient, dynamic, inclusive, and sustainable in response to the economic devastation caused by COVID-19. The ERC is working to develop a comprehensive set of policy recommendations by engaging the public through virtual town hall meetings, consultations, and presentations, conducting research, and performing data analysis to ensure its focus is wide-ranging. I mentioned before that the ERC has created 10 subcommittees which will focus specifically on different economic sectors, and these include, Mr. Speaker, structural reform, financial services, digitization and conceptual economy, tourism and the orange economy, healthcare and social capital, commerce, entrepreneurship and youth engagement, agriculture, fisheries and manufacturing, family island development, energy reform and environmental stewardship, and labor and education. Mr. Speaker, through the next several weeks, the ERC will work expeditiously to curate and inform their policy recommendations, which will be presented to me and my cabinet by early September 2020. They will continue to ensure that the public remains aware of their work through their various social media platforms so that Bahamians can have an opportunity to be involved in designing the recovery plan of the Commonwealth of Bahamas. Mr. Speaker, to complete its work, the ERC will conduct consultations with various stakeholders, including healthcare providers, patient advocacy group, the National Insurance Board, the Central Bank of the Bahamas, the Clearing Banks Association, BPL, and several private experts with research and policy backgrounds. They will also conduct surveys, webinars, and various seminars to garner feedback from the wider community. In addition to this, the subcommittees have engaged additional members and have commissioned focus groups in some instances to further their studies. A full list of the additional members and focus groups of each subcommittee will be published by the ERC shortly. The committee is drawing upon the reports studied and work undertaken by other civil groups that they intertwine with their work in order to take advantage of the substantial research already done on a number of matters and thus avoid a duplication of efforts. The committee will conduct virtual town hall meetings to engage the public, the general public, with the first one set to be held soon. Mr. Speaker, the ERC and its subcommittee are already hard at work and developing a series of positions and recommendations across the full range of matters being reviewed. In the health sector, they are examining how to create and promote a sustainable health system that allows for full access by all Bahamians. And of course, they are addressing the thorny question of how the country would fund such a system. In social services, the committee is examining the adequacy of our social assistance programs while exploring how NGOs can be used in various capacities to deliver social service deliverables in a more efficient and customer-centric manner. The ERC is examining the country's investment policy, recognizing already that the policy framework and the approvals process for both domestic and foreign direct investment must be brought in line with global best practices if the country is to enjoy sustained and robust economic growth over time. The work of the ERC, Mr. Speaker, and its subcommittees is looking at ways to revitalize our international financial services, recognizing that there are still untapped opportunities to be pursued in a strategic way. Key to economic revival will be energy reform, particularly utility deregulation, and comprehensive land use planning. I am grateful to the Tourism and the Orange or Creative Economy Subcommittee of the ERC for its submission of the Tourism Reentry Plan, elements of which are in the government's published Reentry Plan. The work of the ERC will speak to how Bahamians can be more directly involved as business and property owners in the tourism trade. The ERC is discussing how to improve incentives and access to capital for Bahamians wishing to participate in the vacation home rental market or in the provision of ancillary services in the hospitality industry. Mr. Speaker, I am pleased to advise that the ERC has promised to provide to my office in the coming weeks a policy paper on the Orange creative economy as an early deliverable even before its final report is done. This policy paper, Mr. Speaker, speaks to the funding and expansion of the Orange economy for Bahamian artists and artisans throughout the archipelago. I am told that the members of the Orange Economy Subcommittee are excited about their plans. I assure this subcommittee that my government will act on their bold recommendations. We cannot allow good ideas and innovative approaches put forward to wither on the vine. I should say vine, eh? And, to wither on the vine because some politicians or some bureaucrat is too timid, too rigid, or too concerned with defending their turf. As Prime Minister, I am putting ministers, parliamentary secretaries, permanent secretaries, and heads of departments and agencies on notice. We do not have the luxury right now of doing the same old, same old. The recommendations of the ERC and its subcommittees were not being produced to be read and put on a shelf in the face of stubborn politicians and a sluggish bureaucracy. Again, the issue of food security and sustainability is an important part of the ERC's work, along with integrated farming in the Family Islands. To ensure that there are sustainable distribution channels for local produce and foodstuff, we are developing plans for a native food market here in New Providence as a major venue for Bahamian grown and locally produced food and food products. And Mr. Speaker, my minister with responsibility for agriculture and marine resources is leading that charge. And if he utilized 1/10 of the energy he has, Mr. Speaker, be assured we will have an excellent food market. A centrally located native food market on New Providence will attract scores of Bahamians daily as well as visitors. The ERC is working on proposals to expand use and access to Crown land and on ways to empower residents of respective Family Islands to have more input in the economic planning for their islands. Mr. Speaker, I am pleased to see how Bahamians have embraced change during the pandemic. Businesses have established online portals and shifted, like Cabinet, to e-commerce. Various government agencies have established digital services. The transformation we have long sought in this area is gaining momentum out of necessity. COVID-19 is forcing change on the Bahamas. In government, we must continue to accelerate digitization For too long, we have been content having people wait online for this or that document, then to take it to that office before going to another one in order to get a service. Digital services simplify the process. They make it easier for the service provider and customer. And some businesses have established or expanded delivery and pickup services. These new expanded capabilities will make them more competitive into the future, long after the pandemic is over. And we must embrace the change the moment calls for. We must be willing to try things never considered before. We must be open to new industries, and we must welcome investment, both foreign and domestic. We must be willing, Mr. Speaker, to take entrepreneurial risk and not just wait for opportunity to come to us. I believe in the Bahamian people. I believe in our creativity, tenacity, and our spirit to overcome. We are demonstrating our resilience and ingenuity. Mr. Speaker, recognizing the need to stimulate the domestic economy, the government wishes to encourage local entrepreneurship and product offerings. One such offering will be Downtown Under the Stars. The event, which will take place over several weeks, starting in the latter half of July, is a partnership between the government of the Bahamas and the Downtown Nassau Partnership. Bay Street will be transformed on Friday and Saturday evenings in a comfortable and elegant outdoor pedestrianized cafe setting featuring Bahamian, Caribbean, and jazz music, along with gourmet food trucks and beverage pavilions. The government will facilitate small loans to encourage culinary entrepreneurs and to encourage the development of innovative food truck offerings. The Downtown Partnership, Mr. Speaker, will collaborate with local event planners, local entertainers, and the Bahamas Culinary Association to create an event we can all be proud of. Mr. Speaker, it's our dream and intent eventually to have Bay Street closed off so that we can have outdoor cafe and individuals can wine and dine, as Bay Street would be closed at 7 p.m. until 1 a.m., where individuals can now be entertained and wine and dine on the main Bay Street thoroughfare. And Mr. Speaker, in a COVID era, it is better to have opened restaurants as opposed to closed restaurants. So COVID has forced us to now utilize what we have downtown Bay Street. Proper health and sanitation protocols will be enforced. We expect that Downtown Under the Stars will become an annual event that will cater to residents and visitors alike and will assist the process of transforming downtown into a world-class entertainment and culinary destination. Mr. Speaker, my remarks today are not, of course, a comprehensive accounting of all the work being undertaken by the ERC and its subcommittees. However, I did not want to provide the House and the general public with an update on the efforts. I did want to provide the House and general public with an update on the efforts of the ERC to date. In addition to the full set of positions and recommendations that is to come in September, the ERC submitted a list of preliminary recommendations for consideration between 2020-2021 budget, many of which have been incorporated in some form and articulated already as part of the current and imminent policy plans for the government. These include extending the Special Economic Recovery Zone for Abaco and Grand Bahama to the end of the calendar year, increasing allocations to social welfare spending for COVID-19 impacted persons, redirecting spending to essential infrastructural projects with potential for creating economic stimulus, temporarily freezing all agreed salary increases in government agencies, jump-starting easy to start construction projects related to hurricane repair, making use of future contracts to allow BPL to lock in the low price of oil and natural gas, enacting the draft central bank bill to enable the completion of the legal and regulatory framework for the central bank digital currency, digitizing the process for obtaining a number of government documents including driver's license, passports, birth certificates, death certificates, and marriage certificates. Mr. Speaker, mentioning the passport, about 6 months ago, the opposition and many others used to beat repeatedly on my Minister of Foreign Affairs and his passport department about having long lines and being inefficient. Now they are one of the most efficient passport offices in the Caribbean. So I think the minister and the staff need to be congratulated on the excellent job they have done in turning around the passport into a digital passport facility. Increasing the access to capital for micro, small, and medium enterprises, requiring state-owned enterprises to move more toward a cost recovery model and reduce their reliance on subsidy support from the central government. I am pleased, Mr. Speaker, that the early recommendations of the committee have helped to bring some much-needed insight into the budget process and validation of the government's overall policy direction. Mr. Speaker, I want to advise the House and the residents of Abaco that Baker's Bay has commenced its reconstruction following Hurricane Dorian. It is continuing with its expansion plans. These works are estimated at $400 million over 3 years. As of today, I am advised that 472 persons are employed property-wide, 80% of which are Bahamians. I also wish to announce that the Montage Key and Marina project was approved on the 14th of January 2020. Sterling Montage Limited will acquire Matlow's Key and Marina property and will be known as Montage Key and Marina, situated in the Abaco chain of keys for a consideration of $40 million. Sterling Montage Key Limited took title to the key last month. The project is in the initial phase of designing plans. A heads of agreement is proposed to be executed later this year. The affiliates of Sterling Montage Key Limited, Sterling Global Developments Limited, and Star Construction Limited will take the lead with respect to the proposed construction and development of the Montage Key and Marina project. It is proposed, Mr. Speaker, that Montage Hotel and Resorts Limited will manage the operations and branding of the project. The estimated total capital investment is proposed at $352.2 million. At present, there are 12 persons working on Montage Key, inclusive of employees and independent contractors. It is anticipated that there will be 2,970 persons employed throughout the various phases of the proposed construction. A completion of the project, permanent direct employment, at completion of the project, permanent direct employment is expected to be 250 people. Let me emphasize that no heads of agreement has been signed as yet, and the requisite due diligence and approval measures will have to be done. A heads of agreement for the proposed $300 million five-star residential resort and marina development by Taraz Family Holdings Limited was signed on the 13th of February 2020 in Sandy Point, Abaco. The developer has been progressing with the technical elements of the project and has submitted its environmental impact assessment and environmental management plan to the BEST Commission for review. And these projects and others are a sign of the ongoing restoration of the economy of Abaco and the Abaco Keys. This is a sign by international developers of their faith in the ongoing recovery and rebuilding of Abaco. Mr. Speaker, the Prime Minister's Delivery Unit was established to improve the implementation of key government commitments. One of our objectives has been to shift the culture in the public sector to allow for greater focus on achieving specific and targeted deliverables. This has been applied to the government's 8 key priority areas, which are over-the-hill rejuvenation, land reform, education, safety and security, ease of doing business, energy reform, infrastructure reform, and modernization and digitization of public sector. Prior to the crisis of Hurricane Dorian and COVID-19, many of the targets set by stakeholders across the key priorities have been achieved and in many instances exceeded. I would like to highlight just a few of these. In a presentation on 2020-2021 budget, the Parliamentary Secretary responsible for lands in the Office of the Prime Minister detailed the progress made by the Department of Lands and Surveys regarding the acquisition of critical equipment which will underpin our land reform strategies. As promised, prior to the COVID-19 crisis, we had been focused on and had begun to disseminate land grants from the southern Bahamas coming north. As of March 2020, the Department of Land and Survey prepared and finalized 49 Crown grants for Bahamians, including on the islands of Inagua, Crooked Island, and Mayaguana. Now that some of the restrictions on travel concerning COVID-19 have been lifted, surveyors will be returned to the Maikal Islands, and we will continue this important work to empower Bahamians through land ownership. Mr. Speaker, on the priority of over-the-hill rejuvenation,
Chair recognizes the honorable member for Bamboo Town.
Thank you, Prime Minister. Mr. Speaker, I do now move that the business of this House do continue beyond 1 p.m. today.
second.
Honorable members, it has been moved and seconded that the business of this House do extend beyond the 1 p.m. hour. As many as are in favor will remain seated. Those who oppose will stand. It is ordered that the business of this House will extend beyond the 1 p.m. hour. The Chair recognizes the honorable member for Kalani.
Think about to figure out Go eat some cornflake or something. On the priority of over-the-hill rejuvenation, immediately following the lifting of restrictions, construction recommenced on the southern recreation ground. I am pleased to report, Mr. Speaker, at the end of this month, the Southern Recreation Park will be completed. And I have with me images that I would show. Mr. Speaker, these pictures include a new basketball court, facilities for volleyball, new playground equipment, and more green spacing. We have also already completed the installation of Wi-Fi at the Southern Recreation Ground, and cables are presently being run for CCTV cameras. COVID-19 has caused some delay on the completion of a historical memorial walk we propose to add as a feature to the park. However, I am told that the panels and plaques honoring our historical heroes are being coordinated by the Antiquities and Monuments and Museum Corporation and will be installed. Mr. Speaker, this is a picture of the new Southern Recreation Ground. Mr. Speaker, I think it's important for members of this House to understand that the Southern Recreation Ground has lots of history. And it's essential for us to create a historical walkway with plaques of individuals who have made contribution and are descendants of the inner city. You would know that many political events were held there by Sir Lyndon Penland, Cecil Wallace Whitfield, and many others. And as we walk through what we would call memory or history lane at the Southern Recreation Park, there'll be plaques speaking about such individuals. There'll be plaques speaking about Milo Butler, who's also from the area, Cleveland Edius, who's also from the area, Dr. Walker, who's also from the area. Then, of course, we got Russell's Palm Tree. These are individuals, and Mr. Speaker, I want to thank, I see the member has walked out, has left, but I want to thank the member for being on Grandstand who was pushing and extremely instrumental in ensuring that this project is completed. And he insisted that we must, because of the history, we must establish some historical walkway. Unfortunately, I must say to the member that I don't think his name would be on that walkway at this particular time, but I am certain that his name will be on the park. Mr. Speaker, in addition to renovations at the Alvin S. Morse Park and Sunshine Park, Sunlight Cottage have been completed. Now that restrictions are lifted, Joe Billy Park, Fowler Street, and Christie Park on Nassau Street will be re-engaged and continued. Another key component of the over-the-hill priority, Mr. Speaker, has been our strategies towards the economic empowerment of residents of the over-the-hill community. To this end, we enacted the Economic Empowerment Zone Act. To date, there have been a total of 90 applications made under this act. 50 of these applications have been approved. This has resulted in a total of approximately $1,246,000 in business license, customs duties, and real property tax concessions being provided to these businesses. To further aid in the economic empowerment of residents in the over-the-hill community, the Small Business Development Center designed and implemented 2 special groups of residents from the over-the-hill communities to participate in SME programs. The first group of the over-the-hill program was an 8-week course open to 25 participants. 72% of the participants were able to complete successfully and graduated July of last year from the course. Through this program, clients were awarded a total of $48,000 in capital assistance. The first group resulted in a capital infusion of $48,000 and represented an injection of approximately 42 jobs to the labor market. Total sales for all participants were $2,301,014. The second group of the Over the Hill program graduated in November 2019, and this group doubled its class capacity, increasing the number of participants from 25 to 50. This group has a success rate of 62%, with 31 of the participants successfully completing the course and graduating. The second group of the Over the Hill program resulted in the capital infusion of $65,250 and represented an injection of approximately 100 jobs to the labor market. Furthermore, projected sales for the clients totaled $2,520,662. And prior to COVID-19, preparations were being made and will now be continued for a third group. Additionally, Mr. Speaker, the SPDC will carry out current assessments on performance in COVID-19 environment and continue its mentorship. Stakeholders are presently strategizing on how to enhance the economic empowerment strategies in the Over the Hill community to ensure that the objectives of reaching eligible businesses and entrepreneurs are achieved. As we had previously undertaken to do, the government is now taking steps to expand the area covered by the Economic Empowerment Zone Act in the Over the Hill community. This zone will now be extended south past Wolf Road all the way to Independence Highway, the western boundary, Nassau Street, up to Poinciana, east on Poinciana, south on Blue Hill Road, up to Independence to Marathon, so that would automatically incorporate Montel Heights. It incorporates Ridgeland Park. It incorporates the Grove, continues along Independence up to Marathon Mall, then west on Robinson Road, on to Clyde Road, north Clyde Road to Wolf Road, west on Wolf Road to Collins Wall, which would automatically incorporate the eastern boundary, which is called. So Angleston, Angleston, I thought I had the map here to show you. Unfortunately, I don't have that map. But Angleston, Ants, and Barnabas is now a part of the tax-free zone. So Angleston, what your government did not do for you, refused to do for you, we have. As much as I may tease Angleston, I still would not want you on this side. You stay on that side. Mr. Speaker, this expansion will allow more businesses to avail themselves of the opportunities provided by the government. The project to increase water connectivity in the Over the Hill area is provided for in this year's budget. I can start cutting. Under the education priority in the area of providing universal preschool education to Bahamas, The achievements of the stakeholders were almost doubled what was projected in 2019. Approximately 1,500 preschool students were enrolled during the 2019-2020 academic year. That's 1,500 additional families being given a strong head start and proper foundation for the future. Mr. Speaker, when we started the program, many were skeptical that it could not work. Not only was the Minister of Education successful, the Minister of Education doubled what was projected. Additionally, Mr. Speaker, stakeholders of the Ministry of Education have as a target improving literacy amongst our students using GLAT results to measure this. In 2019, our students performed above the target. Again, he's outshining all I've seen. This is a Minister of Education of all ministers. In 2019, our students performed above the target, moving from 58% achieving grade A through D in GLAT to 63% achieving the same. Minister, with such great results, I and my son were home reading all weekend. We could have had you there tutoring us. Under the ease of doing business priority, prior to the COVID-19 crisis, the stakeholders delivered a 24-hour business license renewal turnaround time, significantly enhanced protective measures for minority investors, as evidenced by the Bahamas' 44-place improvement under this subgroup in the World Bank's Doing Business Index, and a reduction in the number of days required to register a property conveyance to 22 days on average over 2019. Despite these achievements, we are aware that the government must work even harder if its efforts are to be felt by the business community and general public alike. In light of this, a comprehensive strategy is being developed and is being implemented to include an array of technological, operational, and legal reforms. Under the energy reform priority, during this past fiscal year, our stakeholders have successfully completed 250 kilowatt solar power retrofit at the Anatole Rogers High School. A state-of-the-art solar field has also been developed on Ragged Island, as my government undertook to increase the resiliency on that island's infrastructure in the aftermath of Hurricane Irma. Other solar projects currently in pipeline include the development of a solar car park at the Prime Minister's office, the Cecil Wallace Whitfield Center, as well as solar and battery storage systems at the TG Global Primary School. The Bahamas has already been recognized and awarded internationally for some of its completed solar projects, and this fiscal year, we have allocated some $80 million to the continued development of the resilient energy solutions and renewable energy reform throughout the Bahamas. Mr. Speaker, we should be clear to the extent of the twin crisis facing us. The COVID-19 pandemic has killed nearly 500,000 people around the world, and we are nowhere near the end of the pandemic. Here in the Bahamas, we decided to take tough measures early. We did not wait for it to get bad before we acted. Mr. Speaker, I have had very little to say in my contribution or over the past few months about the opposition and the leader. But I must note, just for 10 minutes. But I must note, it's mild though, that he spoke and acted irresponsibly at the outset of the pandemic. Dr. Martin Luther King Jr. once said, The ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at times of challenges and controversy. I decided that I would not spend much time in this debate discussing the publicity stunts and foolish talk of the opposition, especially in light of the historic circumstance in which we find ourselves. But let me say this: the leader of the opposition has stood in an unfortunate place during the past 10 months. The nation cannot take seriously a leader of the opposition who, in the face of the most powerful hurricane in our history, decided to dress up in a yellow raincoat and drive a truck through a neighborhood in New Providence, pushing more water into the people's home than the hurricane did. The country, Mr. Speaker, cannot take seriously a leader of the opposition who at the outset of the COVID-19 pandemic said that the government was overreaching. He misunderstood the moment. His judgment was dead wrong. A report in the National Guardian of March 20th, 2020, under the headline, "Measures are an overreach," noted, opposition leader Philip Brave Davis last night accused the government of overreaching in the measures it outlined in response to the COVID-19 pandemic. The story noted, Davis' response came after Prime Minister Dr. Hubert Minnis announced that as of today, a curfew will be imposed across the country and all businesses will be limited, with limited exceptions, will suspend operations for a period of 11 days. At a press conference, Davis said, I quote, "We are aware of the announcement made by the Prime Minister a few hours ago with respect to an emergency order introducing measures that will affect the lives of all Bahamians in ways unknown to any of our lifetime. We are concerned that this was all done in heated rush." Mr. Speaker, the leader of the opposition was dead wrong. My government's decision to act decisively at that time was taken after consultation with the health officials. We acted quickly because we saw what was happening in the world, and we wanted to get ahead of the deadly virus as quickly as possible. I acted quickly as Prime Minister because of my experience as a medical doctor and as a former Minister of Health who had to deal with previous global outbreaks. The leader of the opposition also said, as we see it, the measures are inherently contradictory and may pose more challenges than providing solutions to the ultimate goal of protecting our people. He said, many of these regulations are a clear overreach with no benefit. Mr. Speaker, because of our immediate and comprehensive actions, we saved lives. Protected, let me finish, man. I didn't read what you said.
Not a point of
All
order.
right, then let me finish, then you accept what you say. So let me finish.
On a point of order, the chair recognizes the honorable member for Cat Island, Rumkey, and San Salvador. On a point of
Full
order.
story is not told.
Take the rule.
The member agreed with me 2 days after that statement. He called me, we sat down, we spoke, I gave him the reasons why he said it was an overreach. As a result of that, he, his Attorney General, with Ms. Darrell, what's her name? Ms. Darrell Regis on the line, corrected most of those issues. At least say that. Yes, I said those things. I said it because you and I were to consult. You didn't consult me. And then when we did consult, you agreed with me, with your medical, what's the name? With your Attorney General present, with Ms. Dalridge's present, on the phone, and we came up with the re-amended COVID orders. If you know, 2 days after that, 2 days after that, check the dates, 2 days after that.
Let me finish. You can have some clarity. Because of our immediate and comprehensive actions, Mr. Speaker, we saved lives.
Yes, sir.
Protected the general health, and made sure that our public health structure did not collapse under the weight of the pandemic. The Nassau Guardian story concluded, but Davis had suggested such orders may be unnecessary, as he said the public was already compliant with recommendations made by the government in relation to the novel coronavirus. The leader of the opposition also said, I, however, note that to date there has been no reported case of non-compliance by Bahamians to any guidelines and public service announcement issued by the government on COVID-19. By his words and hesitation, Mr. Speaker, we realize that the leader of the opposition would likely not have reacted as quickly and as decisively as this government and this Prime Minister. As the young people like to say, now listen to me, leader of opposition, the young people like to say, he was not ready for prime time. All right, I finished now. At the outset of the pandemic, with the need to act quickly, he failed the primary test of leader and proper judgment informed by medical science and good public policy. He initially failed to understand the nature and the severity of the pandemic was on the way, and that has taken hundreds of thousands of lives globally. It is often good to have a doctor in the house, health officials at home, and global health officials have noted that because of the quick response of various governments around the world, that lives were saved and the health of scores of people were protected. We did the right thing in the Bahamas and in most of the Caribbean countries. It is fortunate that the PLP and the leader of the opposition were not, let me repeat this. It is fortunate that the PLP and the leader of the opposition were not in office when the pandemic began in the Bahamas. He and they would have been a disaster during this time. History and the voters will judge the words, the gimmicks, and the poor judgment of the PLP during the COVID-19 pandemic, including their setting up a separate PLP COVID-19 committee. For our part, we have the historic responsibility to respond creatively and broadly, and the challenges exposed by Hurricane Dorian and COVID-19. This is what we have done. This is what we will continue to do. Seeing the large number of deaths in the countries that waited too long, I am convinced my government made the right decision. As doctors, we are trained to act early
Let him give a speech.
and decisively with an illnesses in order to prevent them from getting out of control. Now that we are easing restrictions in a phased and gradual manner, the leader of the opposition is wondering whether we are moving too fast, though at the beginning of the outset, he said we were overreaching. He keeps contradicting himself and tying himself up in knots. When you are a leader of a country, you have to make hard and tough decisions. You don't have the luxury to ponder and criticize for the sake of criticism, like the leader of the opposition, who have failed the test of leadership at this time. Mr. Speaker, we cannot ignore nor sugarcoat the depth or the nature of the deep economic crisis we face. COVID-19 shut down our tourism economy like no other time in our modern history. Our beautiful hotels were closed. Our world-class cruise ports in Nassau had no ships, no guests. It has pained me to see our once bustling downtown and hotel zones as a near ghost town. COVID-19 has devastated the global travel industry. According to the International Air Transportation Association, or IATA, the global airline industry is forecast to lose a record $84 billion this year. This is 3.2 times higher than in the global financial crisis. The current economic crisis is placing stress across the global tourism chain. Various borders remain largely closed, preventing much travel, though some degree of opening is starting. The Bahamian economy is overwhelmingly dependent on tourism. What we lost since the beginning of the virus has caused tremendous hardship, though we are hopeful our opening up will bring some visitors to our shores. I must be frank with the Bahamian people. Do not expect to immediately see the same number of tourists we had pre-COVID. We were a country that welcomed 7+ million per year. With this reopening initially, there will be fewer people than we were accustomed to. Things will open slowly and gradually. The tourism sector will only be able to employ people to match the number of tourists who come as the new normal unfolds. As the world continues to open up, we are likely to see more visitors in time. However, we must be mindful that no one can predict what the virus will do. If there is significant resurgence in the countries our tourists come from, these places could reimpose lockdowns and border closings. These are uncertain times, but we must do all we can to prepare for a gradual reopening. We must redouble our efforts to give the best service and warmest experience to the tourists who visit us. Make them feel welcome. Do not take their presence for granted. I commend the Ministry of Tourism, our hotels, and others in the wider tourism sector for their hard work, preparing to welcome travelers back to the Bahamas. Our strong actions as a government to stop the spread of this virus make our country an attractive destination. No one can accurately predict what the hotel occupancy and visitor numbers to the Bahamas will be like a month or even 2 months after reopening to international visitors. We will just have to wait and see. The good news is that the Minister of Tourism and Aviation tells me that they have much better tools nowadays to forecast the level of business more accurately. So those tools will be working overtime to enable us to communicate monthly, if not more frequently, on what business forecasts are like in tourism for upcoming periods and share that information with our communities. I note, Mr. Speaker, that Bahama has advised, notwithstanding its revised projected opening date, which is now October, that it will immediately recommence construction and utilize the time of closure to continue the $300 million expansion to its resort offerings. The property's Phase 2 evolution will include amenities such as Mini Blue, a 18-hole miniature golf course, and new retail stores including Tory Burch and Mont Blanc, as well as fan favorite Sugar Factory. These projects will be the main focus throughout the coming months and launch upon the fall reopening for guests to enjoy. At the end of the year, celebrity chef Marcus Samuelson's latest restaurant concept will be added to Bahama's dining portfolio, and the development of Bahama Bay, the resort's luxury beachfront aqua adventure experience, will be continued and is projected to meet its targeted 2021 opening. Contemporary upgrades and improvements to the Malia had already begun in October 2019 and will also recommence within the coming days. All of Bahama Phase 2 projects have been awarded to local contractors, providing direct and immediate employment for more than 300 Bahamians. The $300 million expansion is an investment in the future. It is a sign of confidence that Bahama is committed to creating the best platform for a successful reopening in the fall. The global ports redevelopment of Nassau Cruise Port continues, and the group remains enthusiastic about the prospects for what will be one of the best such cruise ports in the region. Carnival Corporation has indicated their intention to move forward with both the Grand Bahama and Half Moon Key projects and are working toward getting both projects started. Mr. Speaker, the government recently approved Venetian Development Limited and its affiliate, Southern Capital Holdings Limited, to develop Venetian Village Hotel and Restaurant Resort to be developed on approximately 86 acres of land in western New Providence in the vicinity of Old Fort. But I will have much more to say about this, Mr. Speaker, at a later time. Mr. Speaker, all public servants, I repeat, all public servants are to resume work duty on Monday, June 29th, 2020. I repeat, all public servants are to report for normal duty on the 29th of this month, Monday. Work begins at 9 a.m. for some and earlier for others. Employees with compromised health systems to work remotely for a period of 2 months on receipt of a medical certificate. Now, some people say comorbidities are hypertension, diabetes, obesity, but 6% of our population, including me, are obese. Let's go to work. Permanent secretaries are to implement a shift system in support of social distancing for a period of 2 months in ministries and departments where necessary. Mr. Speaker, I have no doubt we will get through the present time. I know this because of our faith in the Almighty God. I know this because I have seen the resilience of our people and the bravery of the first responders, uniformed branch members, medical personnel, and public officers, and private citizens who responded to Hurricane Dorian and the COVID-19 pandemic with hope, with courage, and with generosity of spirit. I believe in Bahamians, Mr. Speaker. I believe in the Bahamas. I believe in the Lord of new beginnings, who is our fortress and our strength, our shield at all times, and from whom all blessings flow. I assure the Bahamian people that as their Prime Minister and the government I lead, We'll do everything in our power to be there for them as we battle through these challenging times together. We will come together, we'll come through this stronger and more resilient. May God bless our Bahamas, and may He grant us wisdom and discernment as we continue the long and hard work to restore and transform our Bahamas. Let us begin, Mr. Speaker, a new season of restoration and transformation. I thank you, Mr. Speaker, as I support this 2021 budget.